Alrighty. Hi guys, good morning. So we're talking about tick season. We're in summer months. We're out on the water. We're by, the ocean. We're by all the things. And so I wanted to talk about tick bites and Lyme disease because the amount of times that I test people for tick concerns when they're having problems is frequent. And the amount of times people end up having actual infections is way more prevalent than what somebody would experience. So a lot of times if I'm looking at blood work, something that I do find for people is that they would say, there's no way. There's no way I was bit by a tick. No way. And you really wouldn't necessarily know. I think there's this expectation that, oh, you're definitely going to see the tick. You'll definitely find it on you, or you'll definitely have that bullseye rash. I had a woman yesterday and she was like, oh, well, I didn't get the bullseye rash. And I'm thinking, well, less than 30% of people actually get a rash. And they could be so minuscule, like little baby freckles. They could also come in on animals or pets. So let's pretend the dogs are outside, the pets, the cats, they come inside, they roll around. All of that stuff can actually cause the tick to fall off. And then guess what? Now it's in your couch. So we are in the hub of the season, and literally 100% of the time when I ask people, have you been bit? Their answer is there's no way. And then I'm thinking, well, your blood work shows otherwise. And actually the cool part about the blood work is that you can kind of differentiate between were you recently bit or were you bit before. So you can actually time it to tell information about when did it happen. And another thing that I find to be true is sometimes people have antibodies against Lyme disease. They've already been exposed. They've already been bit. And for some reason, there's this thought that people say, oh, okay, that's good, right? Like I have antibodies. Yes, it's good that you made antibodies, as you should anytime you're exposed to an antigen. But what we can't really know is what did that infection do when it did come in. So I guess a really good analogy, for example, would be like getting an infection from C19, still calling it that, right? Well, the problem is not that you got it or that you're over it, which at this point it's 4 years in. Most people have said, I've already been exposed. I already got it. I did my due diligence and felt fine. The problem is though, what did it do? Not did you get it and are you over it? That would be so simple. It's to get something and be over it, right? Like I got it, I'm good. Follow the bell-shaped curve. I feel better. The problem is, what did it do? What did those bacteria, in particular for Lyme, do? Did they go somewhere? Did they create dysfunction? Did they turn on inflammatory markers? There's a lot of autoimmune conditions that are actually linked to infections. And so that is one of the proposed mechanisms of how did I get this autoimmune condition, right? Some people ask that question, and it's a really great question. And some of the things we like to think about is, well, what happened to the immune system? Was it exposed to a pathogen, a bug, a virus? Was it exposed to toxins, environmental toxins, right? So tick bites are a huge thing. We're in the season of it. And there's some really good products. So basically a couple things I could share is if you do think you were bit by a tick and you're aware of it, which most of the time you're not, they do recommend take the tick off if you can. Grab some tweezers, grab something little. Don't scoop it out necessarily, but try to remove the tick. Put it in a bag, bring it to a local hospital. The hospitals are interested to test them. They will test it for free, and they want to know where are the ticks that have Lyme disease. Are they around us, right? Where in the environment are they? They're interested to know that stuff. So they'll look at that, and if it is positive, they might start a course of treatment with you. I don't personally love the treatment options that are given by primary medicine in the sense that it wipes out your own immune system. So they traditionally give something like a doxycycline for, I don't know, a couple weeks, sometimes 4 weeks, a full month worth, sometimes a little bit longer, depending on the infection. But A, it could be a preventative strategy that they're doing, so you don't necessarily know if you were bit. B, you could have a false negative, where if you're testing too soon, your body says, no, I haven't been bit. Just like if you test for C19 too soon, your body hasn't made an immune response yet. So if you test it too soon, you're going to get a result that says, no, I don't have it, when quite in fact you might. You just have to test a couple days later. And I really don't love the actual treatment because it can wipe out your own natural immune system's response. So think of it like this. I give this analogy all the time, and I think it's a good one, is that imagine this room, or imagine a room that you have in your house, and there's rats in the room. And you kill the rats, right? You kill all the rats, they're gone. Great. But a better thing to think about too is, well, how did the rats get in? Did they get in through walls? Did they get in through holes? How did they get into the room? The structure of the room might have been compromised. So not only do you want to kill the rats, but you probably want to redo your walls or redo your floorboards or look at the environment. And that's another factor that does not get discussed with primary medicine, is that let's go in and kill your rats. Well, let's also build up your own immune system so that you're not getting infections and you can handle them, so to speak, or get rid of them. So I'm not saying it's a bad strategy. I just don't think it's like a fully encompassing strategy. I think there could be a little bit more to do to build up the person's body versus wipe out their bacteria, wipe out the good and the bad bacteria that are beneficial to help you fight things. And another thing that people sometimes forget, which is common, but just because you take an antibiotic and you take a probiotic to kind of combat those side effects, well, probiotics are not the only thing that gets depleted when your body does take an antibiotic. So everyone's like, oh, well, I'm good, I take a probiotic, right? Not the only thing that gets depleted. Enzymes get depleted, other parts, mucous membranes get thinned out. There's other factors that actually happen. And we would actually prefer to build up your immune system. So like I said, I'm not saying it's a bad strategy. It could be very effective. Obviously, you cannot walk around with infections, but we might want to do some herbs, which work very well to get rid of infections, and then build up your environment rather than just burn down your forest, right? We don't want to just do that. We have to put in new trees and new flowers. So you have to think about the environment and the body as well. But my suggestion is, at the end of the summer, I encourage everybody to get tested for Lyme disease. It really is something that's like, I would recommend it every year. So probably by maybe November, if you haven't done it, do it. Okay, there's a couple tests. You can get a Lyme panel. It looks at both an IgM response and what's called an IgG response. And you can also get tested for co-infections, which are other infections that when you get bit by a tick, the tick does not just give you a bacteria, the tick also gives you a parasite, sometimes parasites, babesiosis or Babesia microti. There's other things that could be embedded in ticks. So they say, hey, I'm going to bite you and I'll give you a whole host of a bunch of things. And you can measure that stuff as well. My reason for bringing this up is because we're in the season of it now, and I am getting more and more people that are having a lot of symptoms that could be physical, and it does pose the question, I think, we need to go looking why you might be having some of this pain, and that could be a part of it. Not always, but it could be a part. So I definitely recommend to do it at the end of the season. Get a nice Lyme panel. Western blots are good tests. They're not the best. IGeneX is the gold standard. You don't necessarily have to start with an IGeneX test, but a Lyme blot test could be positive for people, and also things like parasites and other infections, Bartonella, Babesia. Some people even go as far as looking at things, other critters and organisms, ehrlichiosis, even things like anaplasmosis or vector-borne illness or things that hold pathogens. And it's primarily the deer ticks that do that. So not always, but there's other kinds, and that's something that I would definitely recommend for you guys to get tested for, just to make sure that you're not having concerns, especially if you're someone that is struggling with something else and you're trying to make it make sense. Maybe there's a lot of joint pain, maybe there's a lot of brain fog, maybe there's a lot of sometimes with infections it migrates, the pain migrates, but spirochetes or Lyme bugs love to burrow and make a mess. So they're not, hey, let's go in, let's infect the person, and then let's leave. No, they're actually considered stealth bugs, where they can change their shape, they can hide, they can evade the immune system, they can go in. You don't want to test too soon. You also don't want to test too late. And that's for any infection. That's not just native to Lyme disease. But if, for example, I had strep throat, let's pretend, and I go in to get a strep test today, the morning I woke up with it, it might not show that I have strep throat yet, right? I haven't built up the antigens. So my body might not know that. So testing time is so important. Testing at the end of summer is so important. Testing for co-infections is so important. and being diligent, especially if there's physical pain or emotional symptoms, which I know sounds really weird, but if you talk to anybody who's Lyme literate or any patient who's experienced bug infections, they can definitely tell you it's not just physical symptoms that you might feel. It could look like anxiety concerns. It can look like mood changes. It can look like immune things like fevers, sometimes that crop up for no reason. It can look like other weird things that might make you say, well, what's going on? Whenever you're not sure what's going on, for example, Lyme is actually considered the great mimicker. And why they call it that is because it mimics everything. It can look like physical pain. It can look like osteoarthritis pain. It can look like rheumatic pain. It can make joints swollen. It can look emotional. It could be changes in the person's mood. Spirochetes can actually enter the brain. They can go to the liver. They can go in lots of different spots. So it's a very big deal. And I don't think it's really talked about, especially where we live. You know, we live by the water. We have ticks all around us. We're in a hub. If you look at the map of where people have Lyme disease, obviously Lyme, Connecticut, which there's a lot of talk about how Lyme came to be. I won't get into that, but certainly there's some thoughts that it was put here. Doesn't really matter, right? It is here, so who cares? But how do we make sure that we don't have it? How do we make sure that we're not infected? How do we make sure that our immune systems aren't compromised? And that would be something to think about. Now, the natural treatment, which, looking at my shelves here, I have some herbs, for example. Somebody might think, well, what do I do holistically if I don't want to go the classic route and do all this stuff? I don't want to be on an antibiotic for a month or 3 months, right? What do I do? There's herbs. So there's natural herbs. There's companies that make herbs that can be very helpful for spirochete load. So things like andrographis, Japanese knotweed, any antimicrobial herb, antiparasitic herb, and antibacterial herb. There's combinations and formulas, enzymes and herbs that can get rid of it and not compromise your own immune system, which is kind of cool. So like I said, I'm not saying don't get the treatment or you shouldn't have done that. No, but it might be warranted to maybe look at, A, am I infected? B, are there other options that could benefit my body, especially if you're already compromised and have gut issues, right? Like somebody might say, well, I'm going to have to do this treatment and I have really bad Crohn's or colitis. Sometimes antibiotics can make that stuff a lot worse. Or I'm already really bloated. Well, guess what? Antibiotics can make that a little bit worse. So there's a time and place to figure out which course of care could be best for your body. But just know that there's natural things. I think people sometimes panic and they're like, what? When I talk to people with their lab work and they have Lyme, they're like, their faces drop, their body drops. They're like, what? And I think part of that's because they know how serious it could be. They know how serious the medical research says the side effects are for people, and it can make people feel very scared. There are options for you. You can do bug protocols, herbs, supplements, tinctures. There's so many things that you can do to kill them off, eradicate them, and build up or maintain your already built immune system. So just want to talk about that because I know that we are in the season of it. I see them all the time. I actually saw one yesterday, a little tick, and I'm thinking, okay, obviously here we go, right? It's important to wear proper clothes. It's important to use natural sprays. There's certain essential oils that they do not like. In my building, when it rains, there are centipedes. They are disgusting. They freak me out. I have screamed bloody murder. The building manager has come in saying, what is wrong? I don't like them. They really, really, really make me freak out. But I found a strategy. I spray thieves spray. There's some smells that I figured out just by spraying it that they don't like. And so guess what? I have never seen one in my office again. So I use thieves, and it has a couple essential oils in there. And same thing with bugs. So even for Lyme disease, there's some actual natural bug repellents that you can get that will kind of keep them off. They're not foolproof by any means, right? It's not 100% guaranteed, but there's certain things that they don't like to smell. And if you spray that on you, obviously wearing tighter clothes, when you come home, clothes go right in either a bag or the washing machine. So it's not, hey, I'm wearing my clothes that I just went hiking in while I'm cooking dinner. And guess what? They're little baby bugs. Okay, so they could be hidden. So just wanted to share that, and hopefully that's helpful for you guys so that you're not panicking. Just get tested. That's my favorite thing to do. Be diligent about it. You know, proactivity is the best way to handle your health. And then, of course, if there is something that crops up, connect with someone that could help you with that. It could be doing the classic conventional route, That's a good option. It could be looking at another alternative that could be helpful too. And there are tons of lines out there. Brands actually make formulas specific to Lyme, which is kind of interesting, right? There's actually research going into just nutraceuticals, right, which is herbs, botanicals, enzymes that can help with getting rid of spirochete load, which spirochetes are the little corkscrew bacteria. It's kind of how they look under a microscope. Okay, they're called spirochetes. So anyways, I just wanted to say that, remind you guys a little bit about that stuff to do all the things, get the testing, and be mindful of it because it is the season. Okay. All right, I have to go. Have a great Friday. Happy Friday, everybody, and I'll talk to you soon. I'm going to post this for those of you guys just joining. That way you can kind of follow along where we're talking about Lyme disease, bugs, bacteria, pathogens, all that stuff because it's summer. We're in it, right? We're in the heart of it. All right, talk to you guys soon. Have a good day.